Welcome back to Face the Nation. Around the world, the numbers of coronavirus infections, now more than 58 million, along with deaths, nearly 1.4 million people, are staggering. CBS News senior foreign correspondent Elizabeth Palmer reports from London.
Good morning. Besides the United States, there are two other countries on Earth that have now registered more than 6 million COVID cases. They are Brazil and India. And in both those countries, the infection is still growing. Funeral pyres in New Delhi burned nonstop. 2 weeks after the main Hindu celebration of Diwali with its huge festive gatherings, infection rates have surged. That's a lesson to Western leaders struggling with plans for a COVID-safe Christmas. It's a big worry as the virus gathers force in Europe. In Liverpool, in Britain, the military joined a vast trial of new rapid tests. If they work well, the idea is to test everyone in England every week. European ICU beds, especially in France and Switzerland, are filling up. And, says the WHO's Dr. Hans Kluge, the numbers are alarming.
That is one person dying every 17 seconds in the European region from COVID-19.
Sweden is no exception. It started out as an outlier over the summer with light restrictions that let Swedes carry on socializing mask-free. But the experiment has failed. Infections hit a record high this week and deaths are spiking too. At the same time, the world's hopes are focused on the vaccine. Here's a shipment of China's arriving in Brazil where it's being tested. The data so far show it is safe, but not as effective as the two American-European front-runners. Meanwhile, world leaders gathered this week on the mother of all Zoom calls in a virtual G20 meeting. They pledged fair distribution of COVID vaccine to poor countries like Iran, where CBS traveled earlier this month to witness the deadly toll of an infection out of control. But in spite of international goodwill, in countries like this that will rely on the World Health Organization for vaccine, 2021 is already shaping up to be another lethal year. Here in the UK, the results are in on another front-runner vaccine being developed at Oxford University with the drug company AstraZeneca. The data show that it does produce a strong immune response, even in old people. Margaret?
Liz Palmer, thank you. We go now to former FDA Commissioner Dr. Scott Gottlieb, who joins us from Westport, Connecticut. Dr. Gottlieb is a board member at Pfizer, which has just applied for FDA emergency approval of its vaccine. Good morning to you.
Good morning.
Let's start on that vaccine. You heard Dr. Fauci say life probably won't go back to normal in May, but he did seem to agree with the timeline that around that time frame, that's when the vaccine will be widely available. What do you know about that distribution plan?
Well, look, the supply is going to be limited in 2020. As we get into 2021, there'll be much more supply. And I think by the second quarter of 2021, maybe into the third quarter, we'll have a vaccine that hopefully will be licensed for general use if everything goes well and the data continues to support the safety and effectiveness of that vaccine. And we'll be able to vaccinate the public, or a good portion of the public, heading into the fall of 2021. I think 2021 is going to be a much different year with COVID, with the combination of the vaccine and other therapeutics, the therapeutic antibodies that will be in wider supply in 2021. What we really need to get through is the next 2 or 3 months. And what I would say to the American people is there's light at the end of the tunnel right now. Try not to be the person who gets infected in the last 2 or 3 months of the acute phase of this pandemic. We've protected ourselves for 9 months. We have 2 or 3 months to go before we have technological solutions that are going to dramatically lower the risk. We need to just get through a very difficult period right now.
Just to clarify your timeline, when you're talking about second or third quarter, you're saying it's really not until April, May, June, maybe later, that your average healthy person can go get a shot in the arm, correct?
I think that's probably right. The emergency use authorization will be for a limited population this winter. And then what will happen is the companies are likely to file amendments to expand the eligible population as supply expands. So think of the initial population maybe being elderly people who are in institutional settings like nursing homes or long-term care facilities. Then you expand it maybe to elderly people who might be living at home, and then you start expanding it down the age cohorts. So you basically walk it down the risk-benefit continuum. But the point at which it's going to be broadly licensed for that healthy 30-year-old, that's probably second quarter of 2021, maybe early third quarter if things go well. But that's okay, because we're likely to have a quiescent spring and summer because we're going to be getting off a very dense epidemic this winter. And what you really want is a vaccine broadly available in time for the fall COVID season. Also remember, we don't need to vaccinate 70% of the public, because by the time we get through this winter, probably 30% of the public will have had COVID, so they'll have some natural immunity. So what you need to do is get some percentage of the people who haven't already had the infection vaccinated, and ideally some of the people who have had the infection to basically double down on their immunity.
Do you know if there are adverse reactions to the vaccine? And once you get it, will you have to go back and get it every single year?
We don't know yet. I think initially it's probably going to be given on a general schedule until we learn more about the real world benefits of the vaccine and how much it cuts down on transmission of the virus. You know, does it just prevent you from getting COVID symptoms, or does it actually prevent you from getting the infection and spreading the infection? That's one of the things we're going to need to determine about the vaccine and how long the immunity is. There is some data that suggests the immunity is fairly durable. It might last longer than a year, but we just don't know that yet. And we're not going to know it probably at the time that this gets authorized. So my guess is it's going to be an annual vaccination for a period of time until we learn more. As far as the safety profile has been good in the clinical trials. Most adverse events related to vaccines happen within the first 40 days or first 2 months of vaccination. But we're not going to know the full profile until you have that long-term follow-up data. And that's why the FDA is taking a prudent approach here. And they're not going to probably generally license this vaccine until they have 6 or 8 months of long-term follow-up data on the patients who have been vaccinated in the trial, as well as those that they follow who get vaccinated now over the course of the next several months.
Key point for those who hear this may be available next month. It won't actually be widely available for some time. I want to play for you something President Trump said from the White House podium on Friday, and I'd like to get your reaction.
You wouldn't have a vaccine if it weren't for me for another 4 years, because FDA would have never been able to do what they did, what I forced them to do.
Is that true?
Well, look, I think the FDA moved with a lot of speed here, and they worked very closely with the manufacturers. I have no indication that the White House forced them to do that. I think this was the public health mindedness of that agency and recognizing the urgency. I know they engaged very closely with the manufacturers, including Pfizer, which I'm on the board of, as you mentioned, and that certainly helped accelerate these development programs. I don't think anybody was forced to do anything here. I think everyone worked together very hard in collaboration. This was an unprecedented collaboration between the government and private industry because everyone recognized the urgency.
Just back to your broader point, because what Dr. Fauci was saying carefully, he was clearly issuing a warning of what we need to prepare for over the next few weeks. We've talked a lot about progress that has been made in medical research, in therapeutics, in vaccines. But at what point does that progress get just overwhelmed by the infection rate? I mean, do we wipe out that progress just because it's so widespread?
Well, the problem is that the progress isn't going to be widely accessible over the course of time that we're going to be getting through the acute phase of this pandemic, and really the worst phase of this pandemic. What's going to happen over the next 4 or 6 weeks is largely baked in, and the spread's going to be so diffuse around the country that the federal government's not going to be able to backstop local regions who are going to be facing very unprecedented situations. You know, there will be therapeutics available and vaccination available probably to help on the tail end of what we're going to go through. But we're going to have to go through this the old-fashioned way. We're going to have to, hunker down, reduce our interactions, wear masks more aggressively, higher quality masks. Right now, to contextualize this for the individual, the prevalence is about 1.5%. That means if you're in a restaurant with 50 people, there's a 50% chance nationally that someone has COVID in that restaurant. In North Dakota, where infection rates are higher, if you're in a group of 10 people, there's a 50% chance that someone in that group of 10 people has COVID. That's the kind of risk we're facing individually right now, and that's only going to get worse.
You're saying hospitals are going to get overwhelmed.
Hospitals have a lot of ability to create new beds. They've figured out how to surge capacity. Where they're going to get overwhelmed, where they're going to get stretched is on personnel. What we were able to do during the spring wave and then again the wave in the summer was surge healthcare personnel into those regions to backstop the hospitals to allow them to create new beds. So the hospitals can create new beds, they just won't have the people to staff them.
Dr. Gottlieb, thank you for your analysis. We'll be right back. CVS Pharmacy is one of the locations where Americans will eventually be able to get a COVID-19 vaccine when it becomes widely available. CVS Health CEO Larry Merlo joins us this morning from Woonsocket, Rhode Island. Good morning.
Morning, Margaret. Thanks for having me.
Well, I'd love to get your insight for the American people on what they can expect. We hear from the U.S. government, from Operation Warp Speed Commander General Perna, that a vaccine can be distributed within 24 hours of approval to all 50 states. We know the elderly are likely to be among the first to receive it. And I know your company has contracts to give those shots in the arms inside long-term care facilities. What is the time frame when you receive it from the U.S. government? How long before there's a shot in the arm?
Yeah, Margaret, it's a great question. And we have been working closely with Operation Warp Speed and the CDC for several months now. And, our first involvement in terms of administering the vaccine will be in long-term care facilities. That is not anything that is new for us. Our pharmacists, our nursing professionals have gone to skilled nursing facilities, assisted living facilities for several years now, conducting seasonal flu clinics. So we have the systems, we have the processes, we have built the logistics directly for the COVID vaccine. And we just received information within the last few days that more than 25,000 long-term care facilities have selected CVS to be their COVID vaccine provider. So we're in the final step of matching our staffing plan to our logistics plan. And to your point, Operation Warp Speed has said 24 hours after approval, those vaccines will be on the road, and 48 hours after we receive that vaccine, we'll be in those facilities providing that vaccine into the arms of our elderly, our most vulnerable population.
So for someone at home who has a loved one inside a nursing home right now, when they hear the FDA approval happens, what can they expect? Within 3 days, their loved one will get a shot in the arm?
Yeah, we will be starting that process. And we will go to each of the facilities that have selected CVS. We will be performing 3 clinics over a 3 to 6 week period. But we'll be starting that process, as I mentioned, within 48 hours.
Okay. You're hiring thousands of people to do all of this work. Who's actually administering the shots? Are these pharmacists? Are these interns? Who are they?
Yeah, they will be pharmacists along with pharmacy interns and licensed pharmacy technicians who collectively, those will be the professionals that will be administering the vaccines all across the country.
And will CVS employees who are giving the vaccine also be among the first to receive it themselves?
Well, we will wait guidance from the CDC in terms of the various protocols, in terms of the phases and who's eligible for those phases, and we will certainly be involved when it's our turn.
Okay. Have you briefed the incoming Biden administration on the plans that you know so far? And I understand you're saying you're still waiting on a lot of this information yourself. But what kind of contact have you had?
Yeah, we have reached out to the Biden COVID task force. We've talked about the role that we have been playing in fighting the virus, the role that we played in testing all across the country. The fact that we've now tested more than 7 million Americans for COVID, the plans that we have to play an important role in administering the vaccine, and the fact that we have 10,000 pharmacies. About 70% of the U.S. population lives within a few miles of a CVS pharmacy. But equally important, we have built mobile kiosks where, with testing, we have gone into historically underserved communities to bring access to COVID testing. We'll do the same thing with the vaccine. And
what does that mean? Temporary facilities?
Yeah, think of a mobile trailer that we can put on wheels and take it to a particular location to provide testing availability, and we'll be doing the same thing to administer vaccines at the appropriate time when the vaccine becomes available. And we've also talked to the Biden team about our commitment to work with them in terms of ensuring that we work together to make healthcare more accessible and more affordable.
Okay, because when the president-elect said that he doesn't fully endorse the plan to use commercial retailers, grocery stores, pharmacies to distribute because he thinks underserved communities will be overlooked. Do you think there is a blind spot there?
Margaret, for us, there is not. As I mentioned, 70% of the population lives within a few miles of a CVS pharmacy. And we have worked with state officials in terms of bringing testing to underserved communities where we may not have a CVS pharmacy today.
Okay. How stretched are you when it comes to testing demand now? I know if I'm asymptomatic, I can't get a test.
Yeah, Margaret, we have come a long way from that very first testing site in Shrewsbury, Massachusetts back in March. We now have 4,300 testing sites, most at CVS pharmacy drive-through locations. We have seen the demand for testing increase substantially over the last 10 days, and we're continuing to roll out additional testing sites. We'll have more than 5,000 within the next 2 or 3 weeks, including about 1,000 point-of-care testing sites where we'll use the antigen test that will provide real-time results in about 30 minutes. And customers can go to cvs.com, put in their zip code, and find a testing site that's nearest to them.
But if you haven't had contact with someone who's COVID positive and you're not sick yourself, can I still go in and get a test?
You can, and we have leveraged our digital capabilities where we've created a seamless experience for customers to fill out a simple questionnaire, and that will determine their eligibility to schedule an appointment for a COVID test.
All right, Mr. Merlo, thank you very much. We'll be back in a moment with former White House National Security Advisor R Mcmaster. We go now to President Trump's former National Security Advisor, R Mcmaster. The retired Army general has a new book, Battlegrounds: The Fight to Defend the Free World. Good morning to you.
Good morning, Margaret. Great to be with you.
Good to have you. Joe Biden's the president-elect. President Trump has no viable legal pathway to litigate his way to 270 electoral votes. But he continues to raise doubts about the election and to sow doubt among the American public. How corrosive is that to our national security?
Well, it's very corrosive, Margaret. And what concerns me is that the president's kind of playing into the hands of our adversaries. What I write about in Battlegrounds is how Russia really doesn't care who wins our elections as long as a large number of Americans doubt the legitimacy of the result. And I think what all of us need to do at this point is to demand better from our political leaders, in this case, especially the president, that they don't play into our adversaries' hands and divide us further and reduce our confidence in our democratic principles and institutions and processes.
The president fired Chris Krebs, the official in charge of election security, in the past few days after he said there was no evidence any U.S. voting system was compromised. That contradicted the president's legal team. Krebs called that press conference this week the most dangerous hour and 45 minutes in American history and possibly the craziest. Is he overstating it?
I think he's overstating it. We should be confident. Now, of course, I think it was just a travesty to fire Chris Krebs because really what the administration should have done is taken credit for the vast improvements that the Trump administration made in our election security since 2016. Chris Krebs was a big part of a comprehensive effort to do so. But hey, Margaret, it's Thanksgiving week. We should be thankful for the framers of our Constitution because they designed our form of government based on what they saw as worst-case scenarios based on the bloody wars in England in the 17th century. And so we have in place a transition that will occur without really the say of the executive branch, right? The president doesn't get a say in the transition itself.
Afghanistan, I know you feel strongly about the conflict there and our troops who continue to serve. This week, President Trump halved the number of U.S. troop presence from 4,500 down to 2,500 by mid-January, even though violence is spiking, even though the Taliban has not cut ties with al-Qaeda. Is the president handing the Taliban a victory on the way out the door?
Yes, Margaret. In fact, what I think President Trump has done is paradoxically doubled down on all the flaws of the Obama administration approach to Afghanistan by conjuring up the enemy we would prefer instead of the actual enemy that we are facing in Afghanistan. An enemy who, if they win, if the Taliban establishes control of large parts of Afghanistan, gives safe haven and support base to terrorist organizations who want to commit mass murder against us on the scale of 9/11, we will be far less safe and vulnerable to these groups. And I think what happened is the prioritization of withdrawal over our interests led to us actually empowering the Taliban. I mean, if we were going to leave, just leave. But don't force the Afghan government to release 5,000 of the most heinous people on earth. Don't make this assumption that there is this bold line between the Taliban and these other terrorist organizations. Hey, we saw it today with these rocket attacks in Kabul and the images of hundreds of young girls fleeing these rocket attacks. We saw it with an attack on a maternity hospital where they gunned down pregnant mothers and killed infants. We saw it on the attack on the American University in Afghanistan. I mean, what does power sharing with the Taliban look like? Does that mean every other girl's school is bulldozed? Does that mean there are mass executions in the soccer stadium every other Saturday? I think it's abhorrent what we're doing, and I hope that a Biden administration will reassess based, again, on what's in it for us. I mean, Margaret, this is not a theoretical case, right? We know what happened on 9/11.
Quickly, the conflict to come with China. You were the architect of the Trump strategy. Is Joe Biden inevitably headed for conflict with China?
No, and I think what the Trump administration has done is really set us up to be competitive with China. And this should be a form of transparent competition. We know that the assumption on which previous China policy was based was flawed, right? That China, having been welcomed into the international order, would play by the rules, and as it prospered, it would liberalize its economy and liberalize its form of government.
Yeah.
The exact opposite is happening. And so it's important to compete as a way to avoid a confrontation with China.
Okay. R Mcmaster, good to get your insights. Thank you. We'll be right back. That's it for us. Thank you for watching. And today is a sad day here at Face the Nation because it's senior producer Catherine Reynolds' last broadcast at CBS. We want to thank her for all of her hard work. Wish her luck in the future. I will miss you, Kat. We all will miss you. And for the rest of you, have a safe Thanksgiving, please. For Face the Nation, I'm Margaret Brennan.